Here's today's MercyOne Genesis Medical Moments.
We are continuing our conversation about heart failure with Dr. Kasula, a cardiologist here at MercyOne Genesis. So, doctor, how do you diagnose heart failure?
So heart failure is a clinical diagnosis. Think of it like having fever. So when you have heart failure, the most common cause is shortness of breath, and it can gradually get worse, and then you can have swelling in the legs and swelling in the abdomen, as we talked earlier. So it's more like a clinical diagnosis. So when you have that, seek medical attention so that the doctor can run some tests to kind of distinguish between heart failure and some other causes for similar symptoms.
Okay. What are some of the treatment options available to patients here at MercyOne Genesis at the Heart Center?
So there are acute heart failure and chronic heart failure. Acute is when you come in with volume overload, your lungs are filled with fluid. Those things we give them diuretics, which you take the medicines, you can get rid of the water, that will make them feel better. There are certain medications that helps your heart improve the function, so we do those medications. So those are the initial things we do, and then we try to figure out why they have heart failure. That's one of the important thing we need to figure out too. If they have we just talked about other causes for heart failure, so we need to look into why they have it. Once we know why they have it, we can try to control the why part. And if the heart failure gets worse to the point that they're not able to take care of themselves, there are certain devices that we put mainly in the lung arteries that monitor your volume status in your lungs, in your body, so we can know that ahead of time before patient starts feeling short of breath. You have to retain water for at least 7 days before you feel short of breath. So these devices can catch this that much ahead of time so that you don't have to end up in the hospital and take care of that. Now, if the heart gets even weaker and weaker, then we have what we call defibrillators and CRT devices which helps the heart pump synchronously, and that helps the heart function. And what we call the end stage heart disease, where it goes to the point that we can't salvage much, then they're candidate for what we call LVAD and heart transplant. So those are the spectrum of treatment options that we have.
And early on, you maybe even possibly look at lifestyle changes, right?
Yes, definitely. So what we're seeing more and more, so there are two types of heart failures. One we talked about, the heart pumps weak, so that is one. But these days, more than half the patient's heart pump is all right. It's just it's not relaxing enough. So that's the same thing. Like I give this example to my patients. You have a bag of groceries. If the bag can't expand, the blood can't get in. So it's the same thing. So they're getting stiffer and stiffer, and we see that more often in older generation, older people. But then diabetes, obesity, and high blood pressure. These are three most common causes for what we call diastolic heart failure. So eat healthy, control your high blood pressure, control your diabetes, then we'll see the decrease in those numbers. And for the systolic heart failure that we call where the pump is weak, that's because mostly for the heart attack. So stop smoking, again, take care of your health, eat healthy, exercise. So these are the most important things. So no magic bullet, just do the right things.
Yeah. Early on,
yes.
Take care of that so we don't end up here.
Yes,
right?
yes.
All right, so if someone does suspect heart failure, what's the first step they should take?
So if they suspect heart failure, I think they should reach out to the doctor, the primary care doctor, so that they can evaluate them. Because clinically we can say they're in heart failure, but then there is certain tests we do. We do some lab work which will tell us if you're retaining water or not. We can just get a chest X-ray to see if you're filling your lungs with water or not. So when they suspect heart failure, mainly the shortness of breath, the first thing is I would urge them to reach out to the doctors as soon as possible, rather than waiting to the point that they're in late stages.
All right, doctor, some great information you gave us today. Thank you for your time.
I appreciate that.
This was your MercyOne Genesis Medical Moments, and for more information, go to ourquadcities.com and click on the medical tab.